Chapter 6. Safety Rules. Accidents generally occur due to our carelessness. They can result in minor injuries to severe ones. Some accidents may even result in the death of the victim. Accidents can happen at any time and any place. We can avoid accidents by being alert. We can also avert accidents by following certain safety rules. Let's see how we can avoid accidents at different places. Precautions at home. A number of accidents happen at home. Never play with sharp tools or electric gadgets, as you may meet with an accident. Do not play or fly kite on the roof. Do not run inside the house. Sometimes fire may also occur due to a short circuit. Do not try to extinguish it with water. Never tease your pet or any other stray animal. It may bite you. Throw banana peels and other wastes only into the dustbin to avoid slipping. Precautions on the road. Always walk on the left side of the road. Do not board or deboard a moving bus or train. Do not peep out of a moving vehicle. Play only at safe places like in parks and playgrounds, not on the road. Cross the road using the subway or the zebra crossing. Learn traffic symbols and follow them. They inform you about the road and traffic. Precautions against fire. The fire is very destructive when it takes the form of conflagrations. So, in order to prevent it, we can adopt following measures. Never play with matchsticks and crackers. Store petrol and kerosene oil in airtight cans away from fires. Do not wear synthetic clothes in the kitchen. Wear cotton clothes only. Make sure that the gas stove is switched off when not in use. If the clothes of a person catch fire, cover him with a blanket or thick cloth. This would cut off air supply and the fire would be extinguished. Putting out fire. Even a small fire in the house can spread very fast and cause great damage. Hence, it is necessary to control it quickly. We can control all types of fires either by cutting off the air supply or by reducing the temperature of the burning material. Fire extinguishers are devices used to put out fire. There are many types of fire extinguishers. They contain carbon dioxide, CO2 gas or foam. The gas or foam surrounds the fire and puts it off by cutting off the air supply. For petrol or kerosene fire, throw sand on the fire to cut off the air supply to it. Water should never be used in this case because petrol is lighter than water and so floats on it. The fire will then spread faster. For electric fire, switch off the electricity mains when the fire is caused by an electric short circuit. Throw sand on the fire. Never throw water over a fire caused by electricity, since water is a good conductor of electricity and you may get an electric shock. Electric fire is very dangerous. We should use the good quality of electric wires, switches and other electric appliances to avoid fire accidents caused by electricity. First aid. We should try to avoid accidents by adopting the safety rules. However, if an accident still happens, the injured person must be given medical aid before doctor's arrival or must be taken to the hospital. The immediate help given to an injured person is called first aid. It is very essential and can save the life of the injured person. Different kinds of injuries need different kinds of first aid. Let us know how to give first aid in different types of accidents. Minor cuts and wounds. First, wash your hands before giving first aid to the injured person. Try to remove all the dirt from the wound with small pads of cotton soaked in Dettol or Savlon. Cover the wound with a clean cotton dressing to stop bleeding. Deep cut. It is very necessary to stop the bleeding if the cut is very deep and bleeding. First, wash the wound with soap and water Make a thick pad of sterile gauze and press it over the wound. If the bleeding does not stop, use a tight bandage called tourniquet. Nose bleeding. During summer, bleeding from the nose is a very common problem in children. Follow these steps to give first aid in case of nose bleeding. Ask the patient to sit on a chair comfortably with his head tilted back and arms folded above the head. Prepare an ice pack by wrapping ice cubes in a cloth and crushing the ice. Apply the ice pack on the patient's nose. This will also reduce bleeding. Ask the victim not to blow his nose and breathe through his mouth. Fracture. Any break or crack in the bone is called a fracture. The fractured bone causes a lot of pain. The affected area swells up. You cannot treat a fracture on your own. The only first aid you can give is to ensure that the fractured part should not be moved anymore. Follow these steps for first aid in case of fracture. The person with a fractured bone should not be moved without proper support. Keep the patient calm and comfortable and then call a doctor immediately. Tie a splint which extends above and below the fractured bone to give support to the broken bone. If the fracture is in the hand, make a sling using a cloth or a bandage. The sling gives support to the arm and prevents its movement. If the fracture is in the leg, tie a splint around the fractured leg. Do not allow the patient to move his or her leg at all. If the patient has to be moved, he should be carried on a stretcher. Take the patient to a doctor. Sprain. Sometimes joints such as the ankle or knee gets twisted and swelled up. The tissues around the twisted joint are damaged. Sprains are very painful. For first aid, a cold ice pack should be used. Rub ointments such as Iodex or Relaxil over the sprained joint 2 or 3 times a day. Wrap a crepe bandage around the sprained joint after rubbing an ointment. Burns. One can get burnt with fire, boiling water or milk, crackers and chemicals. In case of minor burns, apply cold water or ice cubes on the burnt area. Also, apply an antiseptic. In case of a severe burn, the victim should be sent to the hospital immediately. Animal bites. The saliva of animals like dogs, cats, monkeys, wolves and jackals contain viruses of a very dangerous disease called rabies. When these animals bite someone, the viruses enter the victim's body through the animal's saliva. They cause rabies to the victim, so it is very important to treat animal bites immediately. Wash the wound with soap and water to wash away germs. Apply an antiseptic cream on the wound. This would prevent infection. Take the victim to doctor immediately. The doctor may give anti-rabies injections. Snake bites. When a snake such as cobra or crate bites someone, it injects poison into the victim's body. This poison travels through the blood and affects the heart and brain, causing death. To stop the flow of blood to the heart and brain, apply a tight bandage just above the bite. Do not move the victim. Any kind of movement will cause the poison to spread faster in the victim's body. Try to get the poison out from the wound as quickly as possible. You can do this by making a cross cut about half centimeter deep over the bite with a blade and by sucking the blood. Take the victim to a doctor. The doctor may give anti-venom injections of polyvalent type. This is available in almost all health centers. Poisoning. Boot polish, nail polish, paint, detergents, naphthalene balls and some medicines, if swallowed, are poisonous and often deadly. Keep the poisonous things out of the reach of children and do not keep them in kitchen also. In case of poisoning, try to make the victim vomit. Give first aid quickly. Take the victim to a doctor immediately. Points to remember. Most of the accidents occur due to our carelessness. We should try to avoid accidents by following safety rules. Different kinds of injuries need different kinds of first aid. Wash your hands before giving first aid to the injured person. If the clothes of a person catch fire, cover him with a blanket or thick cloth.